Hi, my name's Dr. Asim Farouk. I'm a GP in Croydon and Chelsea. First of all, people are telling me that this is all a storm in a teacup, that people die all the time with normal flu. And what about swine flu? The whole world didn't die then. Unfortunately, the mortality rate of this is much higher. And also the R0, which is the number of people it infects, is also very high. We know that currently the mortality rate of corona is 4.5%. The R0, 2.5. So you will infect another 2.5 people. What about flu? That's got a mortality rate of 0.1%, an R0 of 1.3. So this coronavirus is 45 times more powerful in terms of its mortality rate. We also know that it will affect even a younger population compared to normal flu. So we cannot underestimate it. What about swine flu? We all heard about that a few years ago. Well, the mortality rate of that is only 0.02%. So although it did affect 700 million people, it only caused 575,000 deaths. So quite a difference. The second thing worth mentioning is the people who are being affected by this. We know that it will affect people who live together with many generations, and Asians often will fit in this category. Often Asian populations have higher amounts of diabetes and heart disease, so they need to be very aware that this can affect them. But what about doctors? We know in Italy there's been 50 doctors who have died because of this, so we cannot underestimate the power of this amongst our doctors. We have a duty of care, and we are going out there putting ourselves in the front line. And many thanks all those people who clapped in the streets, and I saw that in Croydon. In fact, thanks to some of those of you who even let off some fireworks. Great display, thanks guys. But ultimately, it's affecting me even on a personal level. I've got some GP colleagues who've got coronavirus in Croydon. One of my GP friends, his mother has died because of this, and we are hearing this all the time, that in, for instance, a local care home, we've had 4 deaths all in one day. Croydon University Hospital also has a very high number of cases. So yes, we cannot underestimate this. So what are we doing about it? It's important that we protect ourselves. Personal protective equipment is vital. There's a shortage of supplies at the moment. So we need to really push the government to get these supplies out, but also it needs to be the right kind of equipment. We know that surgical masks aren't that effective in stopping this virus. The particle size of this is 0.06 microns. Compare that to the size of a blood cell, which is about 7 microns. So therefore we need an N95 fit mask, which will stop at least 95% of the particles and will fit snugly around the face. As a result, you know if it works or not, because if somebody puts something smelly up against it, then you shouldn't be able to smell it. So therefore, these are the kind of masks we really need. And unfortunately, these are not what we're being given. We're being given the standard surgical masks. We're being given apron, which is only covering a quarter of your body. As well as that, we are using gloves, which obviously we are going to be disposing each time we see a patient. But don't forget, for those of you who are walking around wearing gloves and masks, it won't always protect you. I've already said that the surgical masks aren't that effective. They will only stop about 80% of the particles getting through. But also, when you wear gloves, that's just causing the particles to go on the gloves themselves. And if you then touch, for instance, your face, then you're still going to spread it. And in particular, we have to stop it affecting the mucous membranes. We've also seen some heart-wrenching videos from consultants and colleagues saying that people around them are breaking down emotionally because of what they're having to see and what decisions they're having to make. We haven't got enough beds and enough respirators to keep everybody going. Therefore, harsh decisions are being made. Now, it's really important that we keep ourselves isolated, because otherwise, if we carry on going around and mixing with people, we will increase the spread of this further. So please follow the government advice about the social distancing and isolating, because this will delay the number of people who will get sick, which gives us a bit more chance to deal with the potential tsunami of cases that could hit us. So thanks for taking the time to listen to me. Keep well, keep safe, keep protected.